Today we are going to discuss about the anesthetic drugs. So first of all, before giving any anesthesia, we have to physically examine the patient, and once we confirm the animal is not having any abnormality in the heart, otherwise lungs, and metabolically if it is normal, then we can proceed with the anesthesia. So the anesthesia is divided into three parts because we cannot induce the anesthesia directly. So we have to go step by step. So that's why we use different kind of drugs at different levels. So if we see broadly, they are categorized into pre-medication, induction, and maintenance. So the main criteria why we use the pre-medication is to calm the animal before giving the induction. Before we induce the animal, we have to make the animal calm and without any anxiety or stress. So by using this pre-medication, we can calm the patient and reduce the stress, and also we can reduce the respiratory secretions, because if in case of respiratory secretions, if they still persist during the anesthesia, it can lead to the aspiratory pneumonia. So we use specifically the anticholinergics such as atropine and glycopyrrolate to reduce the respiratory secretions. But the main disadvantage with the atropine is the respiratory secretions will be thicker in comparison to the normal. So apart from that function, this atropine and glycopyrrolate can also increase the heart rate. So we need these anticholinergic drugs, especially when we use certain drugs. They are called as vagotonics. So what is meant by vagotonic? Vagotonic drugs. So it means they stimulate the vagus nerve. The vagus nerve is a part of parasympathetic nervous system. So we know that parasympathetic nervous system can take care of the heart, rest and digest. We call it as rest and digest. So it can stimulate the digestion, and it can calm the heart. So because the heart contains the M2 receptors, so the acetylcholine, which is the main neurotransmitter in the parasympathetic nervous system, it acts on the M2 receptor and causes slow heart rate. Okay, so sympathetic nervous system increases the heart rate and parasympathetic nervous system decreases the heart rate. So certain drugs which were said to be vagotonic, like the propofol and the espromazine and opioids, they reduce the heart rate and they cause the bradycardia, also sometimes the hypotension. So these drugs are said to be vagotonic. Whenever we are using these drugs, we definitely use the anticholinergics, okay, so that the heart rate can be maintained and the blood pressure will be maintained normally. Okay, coming to the acetylpromazine. So we call it as tranquilizers. We categorize it into either tranquilizer or sedative depending on its dose. So if you give the low dose of the espromazine, it functions as the tranquilizer. If you give the slightly higher dose, it will act as a sedative. So what is the difference between the tranquilizer and the sedative? So the tranquilizers, they will make the animal calm and reduce the stress, but will not cause any drowsiness. Okay, but if you see the sedative nothing but is a mild CNS depressant. It causes the drowsiness in the patient, but it will not cause the sleepiness. The sleepiness is otherwise known as the hypnosis. So it's like advanced stage of sedative is the hypnosis. The hypnotic drugs include the propofol and the barbiturates and the diazepam and midazolam in higher doses. So these type of drugs like barbiturates, propofol and benzodiazepines, they are come under hypnotic drugs. They can cause the sleepiness in the animal. Okay, so that is the main difference between the tranquilizer, sedative and hypnotic drugs. Okay, so the acetylpromazine can act as a tranquilizer in the lower dose, and it can act as a sedative in the higher dose. So coming to the dexmedetomidine, it comes under the sedative. So it can cause the drowsiness in the patient. Apart from this, it can also have the analgesic action. I can explain the mechanism of action of all these drugs in next video. So midazolam and diazepam comes under the benzodiazepine group. They classified as a sedative, and they also have the action of hypnosis, and they do have the property of muscle relaxation. So coming to the butorphanol, it is an opioid, and it can cause the mild sedation, and it is used as an analgesic drug depending on which receptor they are blocking. So there are mainly two receptors, mu receptor and kappa receptor. So if the opioid which stimulates the mu receptors, the mu agonist, the true mu agonist will be having the higher analgesic property compared to the kappa receptor agonists. Okay, so coming to the induction part. So these three, alfaxalone, ketamine and propofol, these three are mainly used for the induction. So we use mostly the propofol as inducing agent because of its rapid metabolism and rapid recovery, and except the disadvantage is it contains the dose dependent respiratory and cardio suppression, and it can cause the apnea as well. We will discuss about these three drug advantages and disadvantages in coming video. So coming to the maintenance part, we use mostly isoflurane and sevoflurane in our common clinical practice. So there are other types of categories which may not directly affect which we may not use them in the direct anesthesia, but they can be used to reduce the pain during the anesthesia. Okay, so these analgesic drugs can be divided into opioids and NSAIDs. Okay, in opioids, buprenorphine, butorphanol, hydromorphone, morphine and methadone. Okay, so in NSAIDs we use meloxicam and carprofen most widely. So there are other group of drugs such as reversal agents. So if any of the pre-medication or induction or any anesthetic drug became the toxic dose, if any anesthetic drug is showing adverse effects, we can use these reversal agents. For example, atipamezole, this can reverse the effect of dexmedetomidine, and if we give the morphine to reverse it, we can give the naloxone. Otherwise, if you want to reduce the adverse effect of it partially, we can use the butorphanol because it's a agonist and antagonist. Okay, so there is one more drug called maropitant. This is an antiemetic. It specifically acts on the neurokinin 1 receptors. So that is we can use this one to reduce the pain and also to stop the vomiting sensation, otherwise vomiting. But the main function of this is to reduce the nausea or vomiting sensation which is created with the morphine. So typically we will give this maropitant 1 hour before administering the morphine. Okay, this is about the overview of the anesthetic drugs.